Hello, my name is Luis Jordan Montenegro-Calla. Well, as mentioned before, I was born in a very poor neighborhood in my country, Peru, where many young people fall into drugs or games because they don't see other options. When my mother became ill and we couldn't afford proper treatment, I saw very clearly how much outcomes in health depend on where you are born and the systems around you. That experience, together with my clinical time in my medical school in Peru, is the reason I want to obtain a PhD, because I want to be able to build rigorous tools that make high quality care accessible, especially for patients who are usually forgotten. I'm especially interested in the PhD in biomedical informatics and health outcomes and implementation science at HOBI because it sits exactly at the intersection of methods and practice. Your program does not stop at building models. It focuses on translating evidence into practice, evaluating interventions in real health systems, and working with vulnerable populations. That combination of informatics, outcomes research, and implementation science is what I need to move from my projects to real-world change. I believe I bring a set of experience that will be useful for HOBI. In microbiology, I developed Montenegro's medium, which is a low-cost serum-free culture medium for Naegleria fowleri that reduces cost by more than 70% and improved yields. I led an undergrad project on organelle stress and parasite, quantifying the ER stress markers like BIP and GRP78 and mitochondrial potential with JC1. In parallel, I built a Movinator, which is a decision support tool that helps clinicians to recognize primary amoebic meningoencephalitis early by integrating symptoms, CS data, and exposure study. More recently, I started developing CALPA, which is a bilingual and an AI co-clinician that listens to primary care, visits drafts, clinical notes, and suggests labs and medications under physician supervision. To support these projects, I'm completing a 4 bachelor's degree in medical microbiology, IT system administration, software engineering, and computer science. I have taken a stamp for AI in healthcare and some NG's machine learning courses. Outside the lab, I have over 600 hours of verified service, including volunteering at campus food pantry while I was myself in a food insecure time, and serving in a student government like the Senate and Weber State. Altogether, this experience reflects my persistent teamwork and a strong sense of responsibility toward patients and communities. My research interests fall into two connected areas. First, I want to develop robust calibrated risk prediction models for infectious disease and acute conditions, especially in settings where limited data and strong biases. For example, how can we detect a rare but deadly infection early using IHR data, clinical notes, and even wearable sign signals, while making sure the model knows when to say, I don't know. Second, I want to study how decision support systems like Amovinator or COPA change clinical behavior, documentation quality, and outcomes in real clinics. Some concrete questions I would like to investigate are: how do we combine causal inference and machine learning to estimate the effect or of an AI recommendation on treatment decisions? How do we design and evaluate triage or documentation tools so that they reduce disparities instead of amplifying them? At HOBI, I see a very strong match with several faculty members. I would be excited to work with Dr. G. Wu, whose work uses real-world data, patient-reported outcomes, and advanced analytical methods to study healthcare outcomes and comparative effectiveness. He focused on casual questions and patient-centered metrics, aligning close with my interests in evaluating AI guidelines intervention in real populations. I'm also very interested in Dr. Mia Lewis' research on machine learning methods on IR data, risk prediction, and early detection on conditions such as sepsis and kidney injury. The Whitehead group integrates temporal IR data, and develops clinical useful models is directly relevant to my goals for reinfection detection and early clinical risk scores. Finally, Dr. Megan Gregory work on human factors and work and clinical decision support resonance with my experience building Montenegro and Kappa. In summary, my goal is to combine rigorous methods, biomedical informatics, and outcome research with my background in microbiology, software engineering, and community service to build tools that make healthcare safer and more equitable. Thank you very much for your time, and thank you for your consideration as well.